Can you believe the Drug Summit is right around the corner, September 15th through the 17th?
Oh, that's so exciting.
I know, we've been doing this for years. Do you remember the first time we did a Drug Summit?
I do.
It was 2012. It was at the Trade Mart, and that was the first time we brought together the side of public safety and public health together to talk about addiction, the opioid addiction specifically. And here we are all these years later, and we are still bringing that resource to the community. It's a great experience. Haven't you enjoyed it?
I've enjoyed it, and what's so relevant about it is that the opioid crisis is just blown up. Then we were talking about it, the numbers weren't as high, and now we've got a serious problem, and this is what this summit is all about.
That's right.
What are the solutions?
Rising up, and what a beautiful time to rise up, considering that we're in the middle of a pandemic. But we are still experiencing the epidemic of opioid overdose and addiction. So it's a timely matter. We weren't able to get together last year. I was so disappointed. But this year we are.
We're going to make sure that people are safe, so it's going virtual.
Virtual.
So going virtual means what, Neely?
Virtual means that we will all stay safe, number one, as Glenda said. It also means that attendees will have the opportunity to take the conference as their schedule allows. So you'll be able to have the benefit of 18 hours of continuing education. And then if you need to go and take time to manage something at the office, you can come back into the program. And then later, if you want to go back and pick up that hour, you have until December 31st to visit that program again. Anyone who's participating from the community and is not interested in the continuing education hours could visit individual programs that are of interest to them. And then if they wanted to share that perhaps with a family member, then they can visit that with their family member through December 31st. And we do have a lot of community outreach.
Yes. Well, if people are interested, how can they register?
They go to the website, www.drugsummit.com. There are only 2 buttons on that website, and one's for nurses. We would love to have all the nurses come, and one's for anyone else in the community, and you can sign up as a community member, and it'll be free of charge. If you're signing up for the continuing education, the fee is $100, which averages out to be about $5.50 per credit hour, which is really, really cheap, in my opinion.
Very. Well, what kind of speakers will there be this year?
Well, that's a great question. You know, the agenda, again, is on the website, drugsummit.com. If you go into the menu items, it's one of the drop-down features. And what you'll see is that we have some of our traditional speakers coming back, members representing the public health community and the public mental health community, talking about the statistics. So it'll be specific, as always, to what's happening in Mississippi. And then there will be national speakers that will come in and talk about some issues that are of interest to providers and families, family resources, family tools, and also things that will help treatment providers improve in their practices.
And we are so proud this year to have some great sponsors. Our state departments have really come through, and they're going to be supporting this conference. We have the Mississippi State Department of Health and the Mississippi Department of Mental Health.
It's true. The sponsors are listed on the website, and we're very grateful for their support.